do have to remember that in a country during a pandemic, God, hopefully we'd never see another one again, though no one knows, there's a very thin line between what you have to do for health and what you have to do for the economy of the country. So, you could, there were people who wanted us to go into a curfew right after 2 cases that we had. Psychologically, it still affected me because I saw some, very sad stories, but we also saw a lot of success. In fact, Malta had one of the lowest mortality rates in the world. I feel that when the UK left the EU, Malta lost its big brother there. We always supported each other, but we're trying to keep that support going on. And what we are trying to use is that Malta, being one of only 2 countries apart from Cyprus that are both in the Commonwealth and the EU, we're trying to act as a bridge in various things. And Malta will be one of the first countries that the UK will come to if they need some kind of support and help. There have been a lot of highlights in these 7 months, but I must say that one of the biggest highlights was meeting the King. I had met him a week before at an event, and when he was told that there's the High Commissioner of Malta, he immediately came over. He had obviously been briefed about me because he immediately obviously started speaking about Malta because he loves Malta a lot. But he knew I was a doctor and started joking, get your stethoscope with you on Tuesday. It was really, really down to earth. When we eventually went there, we were the 3rd in a row of 3 ambassadors. He sees 3 ambassadors in the day. And the chap before me was in and out within 5 to 10 minutes. So I said, this is okay. When my wife and I went there, we stayed for about 40 minutes. And, he wouldn't let us leave. We got on like a house on fire.
A physician, academic leader, and diplomat whose career has been moving from treating patients in hospitals to advising the Prime Minister of Malta. Professor Stephen Montefort is today with us at MedTech World podcast. Professor Stephen Montefort, thank you very much for accepting the invitation.
Thank you for inviting me.
Welcome to the MedTech World.
I'm very happy to be here.
Malta's High Commissioner of the UK.
Yes.
But before we start to go deep in your career and your role today, I want to understand who's Stephen Montefort and what is your passion about medicine, how all of this started.
So, Stephen Montefort is a 65-year-old Maltese man. I was born and bred in Malta. Obviously, I was, in other places, but I come from quite a humble background. None of my family were in any kind of profession. I was the first professional in my family. So it was always an ambition of my parents, and they begged me throughout to make sure that I get a university degree in a field which I liked. It's true that at the time, there weren't the choices that there are today. So I don't know what I would have chosen today. But at the time, medicine seemed to be the natural choice. I always like to interact with people. I always think of myself as being a kind person. And I felt I could do a lot that way. So I went into the course after quite a struggle, because at the time in Malta, there were struggles. There was a 10-year doctor strike at the start of my medical course. So it was against a lot of obstacles. And those obstacles remained throughout the 5-year course. But I think it made me and my colleagues probably tougher. And in fact, now that most of my colleagues are at retiring age, people are realizing that this course, which was a student worker course at the time, have kept up a lot of the NHS going, especially in hospital in Malta, for such a long time. So this is 40 years ago. And up to, a couple of years ago, I was within Malta Day, working literally day and night. And although, there are bittersweet feelings. Now I think it was time for me to change tack.
Indeed.
It was at retirement, but I never found it in myself to go into total retirement.
Let's talk about this. At the beginning of your career, you were awarded with 2 very important scholarships in the UK.
Changed my life.
Changed your life and put you in a very important UK's medicine institution.
Yes.
Later the years, as you mentioned, you play a very important role in the University of Malta, putting the Faculty of Medicine in a very important stage as well.
That's right.
With the MRCP Clinical Paces exam.
Yes.
How all of this reflected on the training today in the Maltese scenario? Yeah.
Sure. So a couple of years after I qualified, I was lucky enough to be awarded the Chevening scholarships by the British High Commission and the British Council. And I used that scholarship to go to the Royal Postgraduate Medical School at Hammersmith Hospital in London. So some of the consultants who are now in Malta Day in respiratory medicine received some training in departments that are headed by my old colleagues. And that, I feel very proud about that, because at my time, I didn't have such people to help me. And I feel that, helping my juniors was not only for their career, but also for the status of our health system, which is, I feel, one of the best that one can get in Europe. Now, regarding medical school, then, because I came back as a clinician and an academic, it was only natural for me to try and get into a university post. Again, there was a bit of a struggle for various reasons, but eventually I got a part-time post, starting off from a lecturer and then up to a full professor. And in 2012, I decided that I should go further. So I applied and I got I became head of department of the Department of Medicine. And at the same time was elected to be vice dean. And I maintained that for 12 years, till last year. And during that time, together with the dean, Professor Laferla, we made a good number of changes. So many changes in the curriculum, we made changes in the amount and quality and theme of the various lectures and tutorials. We changed the examination system, some of which now is being copied by external examiners used to come. They were impressed about that. And that led us then to go into postgraduate exams. And you mentioned the clinical exam of the Royal College of Physicians. Now, when you get your MRCP, although it is an entrance exam into a specialty, you won't get anywhere, especially in Malta, if you don't get this MRCP. And that exam entails 2 written papers, but most important, a very tough clinical part. And my dream was to bring it to Malta. Mm-hmm. And we managed to get it, and we became an examination hub, not only for the Maltese, but also for the Middle East. So we used to do it once to twice a year. This entailed a lot of work because you had to get live patients. Yeah. You had to organize actors, scenarios. It took a lot of work, but it worked. We were given a prize as being one of the best centers. All the advantages were that the Maltese young specialists did not have to go to the UK to do the exam. So they were doing it in their own hospital. Half of the examiners were Maltese. Mm-hmm. The level was very good. Our pass rate here was very comparable, if not better, to the UK. And this was even more important during COVID time, because in COVID time, the UK centers, first of all, stopped any foreigners going into the UK to do the exam. But a lot of centers closed down, but we continued. And this is still going on even after I have left. The people, namely Professor Peter Fsadny and Dr. Josef Mikallef, have taken over this role. And they are successful in keeping it going on. And I hope it continues to go on.
Yeah. You mentioned a very critical moment in history, which was COVID-19. You also play a very important role for the Maltese.
Well, amongst others.
Yes. You were working with patients during COVID-19, but at the same time, you were advising the Prime Minister and also the Minister for Health. How was this strategy for Malta in this crisis?
So, first of all, because of my specialty being respiratory medicine, it was expected. And in fact, at first, we volunteered together with the infectious diseases consultants to be at the forefront. So right from the start, we're encountering these very ill patients. We went into a lot of organization, how we're going to organize the wards, taking care of the patients, the intensive care units that opened up. So there was a lot of work to do. But obviously, being physically there was very important. Now, some people would say, that I was in my late 50s then, so I was, amongst the vulnerable, but I still maintained my role. I used to go there every day, go in with patients. I'm psychologically, it still affected me because I saw some, very sad stories. But we also saw a lot of success. In fact, Malta had one of the lowest mortality rates in the world. Regarding advice, I was in direct contact a lot of the time with the Prime Minister, the Minister, but I must say, other people like the infectious diseases consultants like Dr. Charles Magliazzo-Pardi or Tonio Piscopo, played a very important role. I was involved in some decisions which were quite hairy. You do have to remember that in a country during a pandemic, God, hopefully we'd never see another one again, though no one knows. There's a very thin line between what you have to do for health and what you have to do for the economy of the country. So, you could, there were people who wanted us to go into a curfew right after 2 cases that we had, more than a total lockdown, which we didn't, but we went into lockdown gradually, giving time for the economy. But the Prime Minister or the Minister of Health, really begged us. And for them, health was paramount, and it was very, very important. But to have a complete, total lockdown with a curfew within a week of the first case in Malta would have been exaggerated. I was also involved in and we are lucky enough in Malta to be amongst the first countries to get vaccination. So we're looking at, which people should get vaccination first. And I feel, though there are a good number of people who wouldn't agree with me, I feel that was the turning point in COVID when vaccinations became available. I am more than convinced that vaccinations made a big difference. They saved hundreds of thousands of lives, if not millions of lives around the world. Obviously, like any other medicine, when you have big numbers being given, there will be those few people who are unlucky enough to get, side effects. But then one has to weigh the benefits against the risks. And I feel that the benefits were much higher than the risks. And in fact, I feel that's when we turned the corner.
Mm-hmm. What did Malta learn from this crisis? What changes we saw on the healthcare and, the policy overall?
No, Malta was always very well prepared for this. A few years before, we had been preparing ourselves for a swine flu pandemic, which thankfully never came about. So there were a lot of things going on. Where also, especially again, the infectious diseases people, right from the very first cases in northern Italy, and were in contact with places like Wuhan. Mm-hmm. And at the time, again, we were lucky enough that there was a Maltese doctor who was at the forefront with WHO. This is Professor Gordon Gallia, and he gave us and the infectious disease people a lot of advice. That advice now has been taken, and even the public health people like Professor Charmaine Gauci and the people around her have used this to always be be prepared.
Yeah.
God forbid, something like that happens again. But even, if we do what we already did, I think time has proven us to be well prepared and right.
Fantastic. As you mentioned, it was a bit of being with the patient directly, involved in medicine, but at the same time very close to the government.
Yes.
You did a shift. Now we can see you as a Malta High Commissioner to the UK. How this happened? What motivates this change?
So I am no career diplomat by any chance. So this was obviously a political appointment, like a number of ambassadors all around the world. When it was offered to me, I jumped at the chance. There were two main reasons. One, after 40 years of practicing medicine, especially after, the COVID thing, I was trying to find an excuse with myself to stop. I must say that I do miss patient interaction, but after the age of 60, it really takes out a lot on you. I still maintain my teaching role online. I still mentor a couple of PhD students, so that is not as bad as missing out on my clinical role. The other thing, apart from the adventure of doing something new at the age of 65, was that the post offered to me was the UK, and both my daughters have been living in the UK and my grandchildren in the UK for a long time. So I think it was a foregone conclusion that I'd like to go. And 7 months into the role, I must say that I don't regret it at all. I'm really, really enjoying it.
Mm-hmm. Earlier the year, you had a very special moment in the Buckingham Palace.
Yes.
You presented your credentials to the King Charles III with a very symbolic way. You brought 2 paintings from a local artist. Yeah. Tell us more about it.
So first of all, there have been a lot of highlights in these 7 months, but I must say that one of the biggest highlights was meeting the king. I had met him a week before at an event, and when he was told that there's the High Commissioner of Malta, he immediately came over. He had obviously been briefed about me because he immediately obviously started speaking about Malta because he loves Malta a lot. But he knew I was a doctor and started joking, get your stethoscope with you on Tuesday. Mm-hmm. It was really, really down to earth. When we eventually went there, we were the third in a row of 3 ambassadors. He sees 3 ambassadors in the day. And the chap before me was in and out within 5 to 10 minutes. So I said, this is okay. When my wife and I went there, we stayed for about 40 minutes. And, he wouldn't let us leave. We got on like a house on fire. Very level-headed person, very down-to-earth, very human, which was a surprise. He spoke, with great love for Malta and the Maltese people. He reminisces about when his mother lived here. He asked us about Villa Guardamangia and the Maltese people, how we are going to try and interact in my role as High Commissioner there. So he said, whether I'm going to be involved in renovating or renegotiating the health agreement, which we are doing, how we can liaise with the doctors around him. He has a great passion for complementary medicine. Mm-hmm. And in fact, he immediately introduced me to some of his doctors, and we got talking. Obviously, I'm a champion for conventional medicine, but, we had good talks. Before we went, my wife and I were thinking, what gift we're going to give him. This man has everything. So we commissioned a couple of paintings by a very good artist, Frank Scambry, who is, elderly but still has a great talent. And one of them was of a 6-year-old king with his beloved uncle, Lord Mountbatten, in the Grand Harbour. We did a lot of research about what colors of clothes and whatever. And when the king saw it, he became quite emotional.
Wow.
And so that was really nice. And the other one was of him and Queen Camilla when they were here for the Chogam in 2015 at Mtarfa. And again, he liked that. But the first one, I think, was, really struck him. So we're happy that with our choice.
Yeah. Malta and the UK have been always very close and had a very deep historical relationship.
Yeah.
Today, we send complex cases to the UK.
Yes.
And also locals from the UK, they're being treated in Malta.
Yeah.
How do you push this collaboration and to make it even stronger?
Yeah. So although I meet quite often with all the other EU ambassadors, we also have quite a lot of meeting with the FCDO, the Foreign Commonwealth Office. We keep abreast of things. There's obviously a special relationship between our countries, which is still maintained. Mm-hmm. I feel that when the UK left the EU, Malta lost its big brother there. We always supported each other, but we're trying to keep that support going on. And what we are trying to use is that Malta, being one of only 2 countries apart from Cyprus that are both in the Commonwealth and the EU, we're trying to act as a bridge in various things. And Malta will be one of the first countries that the UK will come to if they need some kind of support and help. And we're trying to make that relationship even stronger. And I think it is working. Regarding what you said about the health agreement, that is a special agreement that is only found with very few countries. It's been there for over 50 years, and right now we're finishing renegotiating it. And the most important part of it is that Malta has a quota of 180 very complex cases, which we send to the UK for free. So these are things that wouldn't be done here. Yeah. Things like bone marrow transplants, liver transplants, very complex surgery on on babies. After that 180, then we are charged at a certain rate, which we're trying to get better. So in all, Malta would send about 500 cases there. They, all the other ambassadors can't believe how the Maltese government supports all this, and even with accommodation and helping the relatives. In return, all British expats, especially who are living in Malta, get free healthcare, get free medication, and both sides are very happy with this arrangement. Obviously, there are other things that we're trying to help with, waiting lists, visas for students. On a personal level and on a High Commission level, we also then try to support the Maltese patients that come there. So I've made sure that I try to meet as many of them as possible. Our, communication is open to them. These are people who are going through a lot. Not everyone comes back alive because some of these cases are very, very serious. So they need all the support that they can get. And it's very nice of us, of Malta, that, the last thing on your mind when you're that sick or your relative is sick is to think about, accommodation or transport. And the government, together with Community Chest Fund, together with Puttino Cares, and there are the nuns there. And I must mention There are a couple of priests there who I think, Father Mario Sant, Father Joe Formosa, who are there every day beside the patients. And they don't just give spiritual care, they really give moral support. I mean, everyone loves them. Yeah. And I feel the country owes them a lot. And I'm trying to support all that. So the High Commission now is becoming more and more involved with this.
To finish this interview, Professor Montefort, we know that your daughters are also physicians. So how
one of them is a physician, but the other one is more into finance and operations.
Mm-hmm. How do you reflect in this in your career? Now you have personal legacy in your family and also your profession, yes. Your career.
So my elder daughter, Maxine, I'm proud to say, is a consultant respiratory physician like me. This was against all odds because as soon as I had tried to dissuade her to go into the medical profession because I knew how tough it was. And even in this day and age, with a woman who wants to bring up a family, it's even tougher. Yeah. So that was one thing that she didn't listen to me and became but then she went immediately to the UK and she told me, I will do everything except respiratory medicine. And she ended up doing respiratory medicine. I'm very proud of her. She's doing very well. She's a consultant in Portsmouth and, I hear good things about her. My other daughter was an auditor in Malta and then decided to do an MBA in Warwick. And since then, she's been in operations. And recently, she was at the Malta MedTech because she was involved in liaising and setting up a company on health AI, which started off liaising with the Mayo Clinic and is doing very well. She's now involved in other projects, but at the time, it was fun in a way, because she hates, anything to do with hospitals or whatever, for her to be involved and to come and lecture during MedTech Malta, which I must say is an amazing conference.
Thank you very much, Professor Montefort.
It's been a pleasure, and I hope I answered your questions in the right way.
Indeed, thank you very much, and we hope to see you in MedTech Malta 2025.
I'll try. Thank you.
Thank you.